Good afternoon and welcome to today's webinar, Addressing Human Trafficking in Native Communities, a Youth Awareness Approach. My name is Candy Carney and I'm a Technical Assistance Specialist with the Human Trafficking Assistance Center, which is a resource of the Administration for Native Americans. I'd like to introduce you to our two presenters today. Michelle Sauvé is from the St. Regis Band of Mohawk, and she serves as the Intergovernmental Affairs Specialist in the Office of the Commissioner for the Administration for Native Americans. Her work includes providing policy and program advice across a variety of issues. In addition, she helps ANA collaborate across federal agencies via participation on various work groups and interagency initiatives. She is currently serving as a member of the ad hoc work group on American Indian and Alaska Native Human Trafficking, a federal interagency initiative. Elizabeth Fenning is a program specialist in the HHS Office on Trafficking in Persons, where she manages the Training and Technical Assistance portfolio, including the National Human Trafficking Training and Technical Assistance Center and the SOAR to Health and Wellness Training, and supports anti-trafficking interagency partnerships. Prior to federal service, she worked in women's health and spent 6 years working with anti-trafficking organization where she was responsible for building localized responses to human trafficking through training and resource development, task force engagement, strategic partnerships, research, and data systems management. We are very lucky to have these two ladies as our presenters today.
Great, thank you so much for that introduction, Candy. This is Michelle from ANA, and I just want to talk to you a little bit about what we plan to cover on this webinar today. First, we're going to do a brief Human Trafficking 101 to make sure everyone is on the same field with what you know. And then we're going to give an overview of a Native Youth Toolkit that we just published a couple months ago. And then we also have some overarching guidance for anti-trafficking outreach campaigns, since this is National Slavery and Human Trafficking Prevention Month. And we also have an overview of available resources from HHS. And as Candy mentioned earlier, we will do some Q&A at the end. So just so Beth and I have a better understanding of who our audience is, we have a quick poll.
And here's the results.
Great, so a fair number of you are familiar with human trafficking, and that's really terrific. But as Michelle said, we will be doing a brief Human Trafficking 101 just to even the playing field for all of our participants so we understand what this issue is before we go into the rest of our presentation.
And since we also know that not everyone is familiar with ANA, we also want to provide you with a quick overview of both the Administration for Native Americans and Office of Trafficking in Persons. Great. So ANA was established in 1974 through the Native American Programs Act, NAPA, and most people are familiar with the grant funding that ANA provides, as well as the training and technical assistance, pre-application training, webinars like this, but we also wanted to make sure everyone was aware that our Deputy Assistant Secretary / ANA Commissioner serves as the visible and effective advocate on behalf of Native Americans within the federal government. So in that capacity, our acting Deputy Assistant Secretary, Stacey Ecofee, has a role in helping to organize HHS's response to human trafficking, and she is currently one of the co-chairs for the ad hoc working group on American Indian Alaska Native human trafficking. So I'll talk about more about that later, but I'm going to turn it over to Beth so she can talk about OTIP.
Thanks, Michelle. So the Office on Trafficking in Persons was established as a standalone office in June 2013. I will say that HHS as an agency first started working on trafficking in 2001, but our office became its own division in 2013. And we are responsible for the development of anti-trafficking strategies, policies, and programs to prevent trafficking, to build the health and human services capacity of our agency to respond to this issue, and to increase victim identification and access to services. So very similar to ANA, we also participate with our interagency partners across the federal government through the President's Interagency Task Force to monitor and combat trafficking. But on this slide, you'll see that our primary functions are to maintain a national human trafficking service through a network of grantees that serve both foreign national victims and domestic victims. We do have two grant programs in particular on the domestic side, our Domestic Victims of Human Trafficking program, whose next FOA will be released in fiscal year 19. We also have our Look Beneath the Surface regional grant program, which works on victim identification and outreach and training around domestic and foreign trafficking. And those are 3-year grant cycles. So we just awarded a recent cohort, but that next FOA or that next iteration would likely come out in 2020. We're also working to develop a culture of data-informed anti-trafficking programming. As many of you know, human trafficking is an incredibly complex crime that is often misidentified or presents with overlapping indicators of related issues like intimate partner violence or substance use or child abuse. So this makes this issue particularly difficult to quantify. So we here within HHS are working to ensure that how we track our impact is consistent. And then finally, really working to promote prevention strategies around this issue, treating it as any other public health issue like anti-smoking campaigns or seatbelt safety, knowing that there are cultural protective factors at play here that can prevent individuals from falling victim to this crime. And there are also risk factors for all of us to be mindful of. So as we mentioned, we did want to just ground you all in a brief Human Trafficking 101. And this slide here, we're going to break down the federal definition of human trafficking here in the United States. So in 2000, the US passed what we call the Trafficking Victims Protection Act, or the TVPA, which was the first piece of legislation to really define this crime. It created new laws, it established remedies and services for both foreign, national, and domestic victims of this crime. Today, I'm delighted to report that all 50 states and at least a half dozen tribes have actually passed comprehensive legislation specific to human trafficking. So in terms of rule of law, we're in a really terrific place in terms of enforcing and prosecuting this crime. Now, I'm not going to bore you all with the legalese by reading you the statute. So we're really just going to break down the law using the action, means, and purpose model, which you'll see here on this slide. And I want you guys to think of these columns as buckets, where you need to prove at least one element and only one element from each of these columns for it to constitute human trafficking. So human trafficking is the recruiting, harboring, transporting, providing or obtaining of an individual by force, fraud, or coercion for the purposes of commercial sex or forced labor. Now you will see here that under the action column, there are 3 additional actions. And patronizing and advertising are 3 actions that were recently added to the legal definition with the passage of the Justice for Victims of Trafficking Act of 2015, or what we call the JVTA. Now, I note that, but at the same time, this is a relatively new change, so the case law around this expanded definition is still relatively new and untested at the federal level. Now, the exception to this rule is when a minor or anyone under the age of 18 is found in commercial sex. You do not have to prove the means or that middle column if you have a minor engaged in commercial sex. They are automatically recognized as a victim of human trafficking. Now, we know that it is not your role to make a legal determination or to discern whether or not a patient or a client of yours is actually being trafficked, but we did want everyone to understand the federal definition of our standards and sort of the framework that Michelle and I are coming from when we talk about this crime. So the TVPA further divides this crime into 2 issues, that of sex and labor. So for sex trafficking, you know, that's the recruitment, the harboring, the transporting, providing, or obtaining of a person for the purposes of a commercial sex act through force, fraud, or coercion, with the exception that I mentioned previously for minors. Now, when people hear the term commercial sex, they very often think that that means that money has to be involved. So it's a sexual act in exchange for something. Now, the reality is it's not just money, it's really anything of value. So an individual could be in a situation where they are forced or coerced or defrauded into exchanging sex for anything of value, whether that's shelter or clothing or food or drugs. And again, a minor also doing that, to survive, really. And some examples of sex trafficking include, the forced prostitution of adults, which I'd mentioned previously, and then any type of commercial sex in which a child is victimized. Now, on the labor side of things, you have means of forced fraud and coercion present, regardless of the age of the victim. But again, it's that recruitment, that harboring, that transporting, providing, or obtaining of a person for forced labor or services through those means of control. And some examples of labor trafficking include forced labor in several industries. The fishing industry is one example. Tourism is an example. I know the National Hotline has received calls of individuals who were forced to manufacture and then sell trinkets on the side of the road. And certainly the hospitality industry is another industry in which we see labor trafficking. Another example is domestic servitude. So these are nannies, au pairs, household staff, cleaners who are working in private homes who are forced into this situation. And then obviously debt bondage. So many individuals who are trafficked, particularly women and children, are exploited, for the purposes of labor and commercial sex, as we already mentioned. And the means of control we really want to break down further so we all have the same understanding. So force can really include physical restraint or serious physical harm, such as rape or beatings, and physical confinement or isolation. Now, fraud can include any false promises regarding an employment offer, wages, working conditions, or the charging of exorbitant recruitment fees. For example, there are individuals who might travel to another country or within their country under the promise of well-paying work at a farm or a factory, only to find themselves manipulated into a forced labor situation. They might have thought that they were promised their own accommodation and in reality are having to share, 6 beds amongst 12 people. They thought that they were going to make X number of dollars an hour and in fact are making half that. They expected to be able to go down to the local Walgreens or CVS to purchase their own personal hygiene products the way you or I do, but in reality are forced to purchase those items through their employer at a significant cost to them. And then finally, coercion, which can involve threats of harm, arrest, or deportation against a person or their loved ones. This can also include the confiscation of passports or any sort of identification documents, because there's the threat that who will believe you if you cannot prove who you are. And then really just any form of psychological manipulation. And the thing that I'll note here is that we are seeing traffickers rely much more on coercive means of control because they leave less physical evidence, making it much harder to prove in courts. But remember that just because you cannot see something physically keeping an individual in a situation, there are coercive bonds influencing them that are just as strong. So in terms of at-risk populations, we really want to touch on a few here. Although human trafficking can happen to anyone, there are certain populations who are more vulnerable and are at a higher risk. And identifying these populations while looking upstream can help public health providers and social service organizations prevent instances of trafficking. I'll just note that the list here is not exhaustive, but we did just want to highlight a few. Certainly individuals who have a history of prior abuse and neglect where that sort of abuse or violence might be normalized are certainly vulnerable. Certainly runaway and homeless youth. I'll also mention LGBT and the two-spirited community are also at a higher risk, especially if they have been rejected or cast off from their family and community and therefore lack a support network due to their gender identity and sexual orientation. There's a lot of LGBT youth who have run away and, are unable to provide for their most basic needs and then are exchanging commercial sex acts to really meet those needs, which normalizes that kind of abuse, making them vulnerable to trafficking. Certainly racial and ethnic minorities, according to data collected by the US Department of Justice in 2013, approximately 73% of confirmed sex trafficking victims served by their grantees were persons of color. Similarly, nearly 99% of confirmed labor trafficking victims were persons of color. And I think really acknowledging these demographics and their levels of vulnerability is a critical part of our understanding of this issue and how to prevent it. Some other groups here, certainly individuals with disabilities, impoverished individuals from lower socioeconomic status, and then communities exposed to intergenerational trauma. So we know that American Indian and Alaska Native populations can be vulnerable to human trafficking given higher rates of that historical and intergenerational trauma. And certainly for more rural communities, there are a lack of resources generally, but also specifically a lack of culturally appropriate services specific to trafficking. So these are a real rarity, and when they do exist, we're hearing that victims and providers are having to travel long distances to connect with one another. So the scope of this issue is something that we always receive questions on, and we're very quick to point interested individuals to the National Human Trafficking Hotline, which is an HHS grantee of ours, and they are the anti-trafficking hotline for the country, and we'll go into a little more detail at the end of this presentation around the resources and the services they offer. But they've been maintaining the hotline since December 2007, and as of December of last year, the hotline has received 143 reported cases of potential trafficking where the victim was identified as American Indian or Alaskan Native. Now, the disclaimer to this is that there are callers who are reporting cases to the hotline who might not be aware of the demographic information of the potential victims in a case and therefore aren't reporting it. Or there are individuals, survivors or victims themselves who are choosing not to disclose their demographic information. So I will just note that that number might seem low, but I think the reality is that those case numbers are significantly higher for this population, but this is just based on those callers who are willing to identify that demographic. But in terms of the split, you are seeing that the vast majority of the cases reported reference sex trafficking. That's not to say that labor trafficking isn't occurring that affects American Indian and Alaska Natives. I think really that reflects our media bias in this country and where a lot of our resources are focusing. I think a lot of the effort has been centered on sex trafficking, particularly child sex trafficking. But globally, the International Labor Organization acknowledges and recognizes that labor trafficking is overwhelmingly the vast majority of what we're seeing worldwide. And I would say that is likely the case here in the United States. We did just want to highlight a few particular networks that were referenced, the most common networks, in fact. So on the sex trafficking side, certainly residence-based commercial sex, internet-based commercial sex, hotel and motel, and then escort or delivery and call-out call services. Now on the labor trafficking, a lot of the cases are actually referencing domestic work in private homes, as I mentioned previously when providing an example of forced labor. Also traveling sales crews. So this is a particular network that recruits young youth, disillusioned individuals and communities that maybe are lacking in resources, or individuals who might have prior criminal history who are finding consistent and gainful employment difficult to maintain. And they recruit these individuals with opportunities to travel the US and see the world. And they use this door-to-door sales model where they are advertising and selling household cleaning products or magazines or other kitchen appliances. And each member of a crew has a daily quota that they must maintain and is very strictly enforced. So the hotline is receiving calls of Native youth who are being recruited to join this network. And then certainly illicit activities and healthcare. So we know that as we have an increasing aging population here in the United States, we have increasing demands on elder care and healthcare here as well. So we're receiving increasing reports of that particular network. And illicit activity could be involved the drug trade, where there might be organized criminal entities who are taking advantage of some of the legal loopholes in certain communities. And then we just wanted to briefly highlight the ages, or the breakdown between adults and minors, and then the gender breakdown of the victims, the potential victims reported to the hotline. So fairly even on adult and minor victims. The vast majority of the cases are referencing female victims of trafficking. Again, I think that's more where that's more indicative of where we focus our outreach efforts, and I think the community's awareness of trafficking. That's not to say that men and boys and other gender nonconforming individuals aren't also victimized by this crime.
Okay, great. Thanks, Beth. And so that brings us to one toolkit that we wanted to share with you today. At ANA, as we took a look at what resources were out there, in particular for Native communities, we realized that across the federal government, there were some gaps in outreach and prevention materials, specifically for youth. And while we saw that some national organizations like Polaris had a tool for college students, resources for younger youth at that time were missing. So since that time, there's been some more resources. For example, the Department of Ed just debuted a film called Little Red that's geared towards youth. And the Blue campaign has also come out with an animated infographic that's much more youth-friendly. When we started on this endeavor to create this toolkit, those resources didn't exist, and there certainly at that time did not exist any resources specifically geared towards our Native youth. So the purpose of this toolkit is to raise awareness and to help prevent the trafficking of our Native youth, and to, if there are youth that are being trafficked, to connect them with services. So I wanted to talk a little bit about the process that we went through in creating this toolkit. As I mentioned, we work with other federal agencies, but in this endeavor, we really felt it was important to work with partners that knew Native youth, who were Native youth, and who were survivors of trafficking. So we did work with organizations like the National Indian Education Association, the Center for Native American Youth, United National Indian Tribal Youth, or UNITY, and American Indian Higher Education Consortium. We also did work with Polaris, as well as a survivor consultant who is Native American. But to get feedback from Native youth. We did a Human Trafficking 101 at a Unity conference in 2015. We introduced them to the college toolkit. We got their feedback through focus groups on what they would want to see in a toolkit geared towards youth. And then we then were able to share a version of the toolkit that was different than the one you're seeing now. And then we really incorporated a lot of their feedback. So the toolkit we're sharing with you today as a resource, one of the handouts that you'll have from participating in this webinar, is really meant to educate, equip, and empower our youth. When we spoke to youth, what would be important to you in a toolkit, they said they wanted more statistics, they wanted stories, and they wanted images that reflected who they were, as Native youth. We tried to balance these requests with the lack of available data on human trafficking of American Indian, Alaska Native, and Pacific Islanders, privacy issues for survivors, and the desire not to sensationalize or re-traumatize survivors, as well as interagency guidelines on images. So Beth will talk more about using images in public awareness campaigns in a little bit. So our partners knew that having a toolkit that was culturally grounded would help the message resonate. And we attempted to add these elements into the toolkit while understanding there is no one culture or experience, but a multitude of perspectives. The toolkit is not a one-stop resource for trafficking, but because youth asked us to keep it brief, it's meant to be engaging and bring awareness and have action steps for youth who want to get more involved. We intend for it to complement the resources available by our many federal and non-government partners. We hope you can familiarize yourself with the materials and share the toolkit with youth groups in your communities. And if possible, make it available on your website. Groups you might share with include youth councils, boys and girls clubs, church youth groups, and middle schools and high schools. We would love feedback at a later date if you do share it with Native youth. We have our contact information at the end of the presentation. So I'm going to turn it over to Beth so she can talk a little bit more about the best practices on outreach campaigns.
Thanks, Michelle. So as Michelle already highlighted, the Native Youth Toolkit is one of the handouts available for download to the right in your GoToWebinar panel, and we hope that this will be of use to you and your stakeholders. That said, we know that many of you here might prefer to develop your own public outreach campaign, and we wanted to provide some overarching guidance that's really been honed by the National Hotline and our federal grantees working on anti-trafficking. So typically when we talk about human trafficking outreach, we're talking about either direct or public outreach. So through direct outreach, this is where trained frontline staff are providing info to individuals at risk, like some of the populations we previously highlighted, who are likely already experiencing trafficking. These materials are distributed on the street and at other locations that are accessible or used by these populations, and they're really handed out on an individual basis. Some examples of materials that have been used for direct outreach include lip balm or feminine hygiene packets that have the hotline number, or small shoe cards with information on how to connect for help. So they might not scream human trafficking loud and clear. They might provide actually more subtle or tactful indications of how to reach out and request help if and when that person is ready for it. Now, in contrast, a public outreach campaign, which is what we're going to be talking about today, is used to really educate the public about a particular issue or area of concern. Now, these campaigns have a much broader audience, and they're displayed typically in larger public settings. And they can really take many forms. And so we provided some examples here of billboards, posters, radio PSAs, social media toolkits like the one that we produced, and other forms of public action. And we're really seeing the benefit of public outreach in an increase in the National Hotline's call volume and the number of cases that have been identified. So we did just want to go through some 6 key steps to the planning process for those of you who might be interested in developing your own public outreach campaign. We know there are advocates on the call, and these 6 steps were really first set forth by Amnesty International, but as I mentioned, have really been honed by federal grantees working on this issue. And to start off with, very simply, it's important for you to research the issue in your community by identifying valid facts and statistics that really quantify that problem. We mentioned the National Hotline as a resource. There might be anti-trafficking NGOs that you are already working with in your community who have a really terrific grasp of the issue. And it's really important to connect with them to determine what forms of trafficking might exist, what populations are at risk, what industries might be effective, and how trafficked persons might be identified. And once you really establish that baseline understanding of the issue, it's then important to really identify your goal. Are you trying to affect broad social change, or do you have a campaign-specific goal in mind, such as obtaining signatures for a petition around tribal legislation around trafficking, or increasing the number of trafficked persons who are identified by a local service agency? There should really be clear asks so that your audience understands what you are asking of them. Next, it's important to then determine who your target audience is. So there are some campaigns out there that are specifically designed for migrant outreach or emergency department staff. And those 2 distinct audiences have very different ways of receiving information in different venues and different capacities, and maybe also in different languages. So it's important to weigh those considerations when you choose your target audience. So when we developed the Native Youth Toolkit, our intended audience was Native youth, so high school age approximately. And in order to be most effective, the outlet and the language for the message really needed to be tailored to that audience's needs. Our next step is really to then determine that method of delivery, which will be most effective. So for example, a poster at a bus stop might be very effective for reaching runaway and homeless youth or migrant workers, but would be less effective for reaching those emergency department staff that I mentioned previously. So they're engaged in their own communities and that they're eager for resources on effective advocacy, which is why we chose the toolkit as our method of delivery for our outreach campaign. Next, it's really important critically to then develop your message. And I cannot stress enough, it's important to keep it simple, to use relevant, and in our case, age-appropriate language, so it really resonates with your audience. You should also ensure that your message avoids misconceptions. So we're going to delve into that briefly in the next slide or 2. And I think the other consideration here is whether or not you wish to translate your campaign into additional languages, and really working with professional translators and local partners to identify those cultural considerations in advance. You want to ensure that your messaging is trauma-informed and culturally appropriate while still remaining true to its original intent. And then finally, really in order to successfully plan your outreach campaign, it's important to determine how you're going to track your impact. So how do you measure your outcomes? So I encourage you all, if you are a service entity who has metrics that you are already keeping track of, outputs and outcomes, to consider how an outreach campaign might increase those numbers, whether it's the number of cases that you're working, the number of victims who are identified. If you're partnering with the national hotline, they have the ability to track local campaigns and calls stemming from those, so that's also another outlet. But you can also, if you're working in a tribal criminal justice setting, track the number of cases on your docket, the number of those that are successfully prosecuted. So there's various ways to really track that. Also, for anyone with a web presence, you can track your social media hits and any downloads of any resources you might be producing. So we did want to just touch on imagery. Campaign images are incredibly powerful and really should be chosen with purpose. Images have the ability to draw connections to the audience's minds that are both intended and unintended. So it's really important to consider an image's impact and socialize that, pilot it, test it with your target audience to really ascertain their reactions before finalizing that. And I did just want to offer this photo as an example. This is one of our own photos that was in circulation in the early 2000s that's thankfully no longer available. But if you look at an image like this, what does it tell you about human trafficking? You know, an image like this might suggest that bondage or physical restraints are required, when in reality, fraud and coercion are other means of control. I think this image also creates some confusion because the woman here is actually in handcuffs. So I would ask myself as a layperson, was this person actually detained by the police or immigration? It sends a very confusing message. You also want to think through the images and your portrayal of a survivor of trafficking if you choose to do so. As we've mentioned, trafficking affects a whole host of diverse populations. It cuts across racial, socioeconomic, gender, nationality, and education levels. So imagery, it's important to be inclusive and diverse in your depictions. You also want to ensure that you're not sensationalizing this issue for shock and awe. So for our toolkit, some of our lessons learned was the enormity of the crime of trafficking can be very overwhelming and very disheartening. And we didn't want to leave our audience with that impression. So in addition to choosing images that resonated with who they were, we also wanted to leave them with a more positive portrayal of their engagement, but also of survivors. So you'll see that woven within the stories and the quotations throughout the Native Youth Toolkit. It's also important to ensure that any imagery you choose doesn't re-traumatize potentially victims and survivors of trafficking in your own communities. So that we've touched on, you know, some lessons learned from our own experience. We did just want to provide some examples of empowering imagery and messaging that we hope you guys will take home. As Michelle mentioned, we really wanted the Native Youth Toolkit to reflect a strengths-based or an empowerment-based approach. So we selected imagery that was both relatable, but then spoke directly to them as youth. So there are positive depictions of community, friendship, and family, which are all cultural protective factors that we're aware of. So rather than focusing on that sadness or that grief, we would encourage you all to focus on the hope and the light and the uplifting part of this message. We do have an example on the slide to the right of a poster that was produced by the Alameda County District Attorney's Office, or Heat Watch, which is an HHS anti-trafficking grantee. And they created this poster campaign for victims of trafficking, and they chose language that sought to imbue a sense of hope that, you know, I was in your shoes, I got help, I got out, you can too. And this is a clear way for you to access those resources by dialing this hotline number or email address. The other thing, as Michelle highlighted, is that we really sought to incorporate the voices and expertise of Native American survivors and experts in historical trauma and Indigenous health and well-being. And so, you know, public outreach campaigns are a really terrific opportunity to leverage those voices and learn from that expertise as well. And then finally, we wanted to provide you guys with a federal example of a public outreach campaign with a very clear ask, drawing in audience participation. So that's part of ensuring you have a clear ask. So the U.S. Department of Homeland Security's Blue campaign includes these posters. They have several posters which are free and available for download on their website. And here you can see, victims of forced labor, domestic servitude, and the sex trade have been invisible until now. So this positive frame here is really encouraging the audience to work towards being part of a solution to this crime and actively engaging by providing them these hotline numbers and ways to request information.
Okay. So now we're going to give you an overview of some additional ACF resources and support that you can access in your community. So as I mentioned briefly at the beginning of the webinar, there is an ad hoc working group on AIA and human trafficking. And the purpose of this work group is to increase the U.S. government's understanding of the unique needs and challenges of American Indian and Alaska Native related to human trafficking, and identify policies and activities to improve the response of the federal government and our stakeholders. Our second purpose is to enhance U.S. government coordination. And just so you have a sense of who is part of our work group, we have representatives from the Department of State, the Department of Justice, both in the Office of the Attorney General and the FBI. At Department of Interior, we have participation from the Bureau of Indian Affairs. For HHS, ANA, and OTIP are partners, along with the Indian Health Service. For Department of Homeland Security, the Blue Campaign, Customs and Border Patrol, and then U.S. Customs Enforcement and Immigration Services. And at Department of Labor and Transportation, also representatives to this work group. The second thing we're doing is we're going to be participating in the Strengthening Sovereign Responses to Sex Trafficking in Indian Country. That's coming up next week, and it's sponsored by the Office on Violence Against Women in partnership with these amazing organizations listed on the slide. Next up, ANA. One of the handouts that you have is an information memorandum recognizing and responding to human trafficking. This is a resource that ANA initially sent out to all of our grantees in January of 2015 as part of the awareness campaign to help prevent slavery and human trafficking. And we've updated it for 2018, made sure all the links are currently working, so you have access to that as well. We have previously hosted webinars. You can access a link from our ANA TA provider site. And we have also been providing training and awareness activities for our current grantees through our conferences. We've had either special workshop sessions, listening sessions, or plenaries at our ACF Native American grantee meetings in 2015, 2016, and 2017. And lastly, I want to make everyone aware that one of our program areas of funding, the social and economic development strategies, can be used to address human trafficking in Native American communities. And we've had at least one grantee who has done that to prevent male sex trafficking in Minneapolis.
So I've referenced the national hotline throughout this presentation. I just want you guys to know that this is a national toll-free and confidential anti-trafficking hotline for the country. They're accessible 24/7, 365 days a year. They can also field calls in over 170 languages through a tele-interpreting service. And their mission is really to provide victims and survivors with access to critical support and services to really get help and to stay safe. They're also there to maintain a referral directory of anti-trafficking service providers here in this country who are part of our safety net and our response system. And they're also there to provide confidential around-the-clock access to a mechanism for reporting tips to law enforcement. They have over 200 local protocols. If you guys are interested in ensuring you have a local protocol established with local service providers and local law enforcement, I'd encourage you guys to reach out to them at that number there, 1-888-373-7888. In particular, survivors of trafficking, young survivors of trafficking, are able to access help and the internet and services through their cell phone. So that important avenue of communication is also available, and you just need to text Be Free or 233-733. And I did want to mention the Strong Hearts Native Helpline, which was launched in the last year. So this is a hotline very specific to Native populations experiencing sex trafficking, and it is funded by the Family Violence Prevention and Services Program, which is a sister agency of ours here at ACF. So they're another culturally specific resource that's emerging. I think they're piloting still in key communities, but they are a tremendous resource, and we're eager to hear all of their lessons learned as they move forward.
And their contact information is on that handout.
I also wanted to mention some free training and technical assistance available to you all. I help to maintain and to supervise the National Human Trafficking Training and Technical Assistance Center, or NITAC. And it is a TNTA center specific to trafficking. And they're designed to really enhance and to inform the public health response to trafficking, to increase victim identification, and to improve the capacity of organizations and communities such as yourselves to really strengthen short, medium, and long-term outcomes for trafficking survivors. We actually launched in January of last year, and in this past year, we've conducted some 37 trainings that reached over 1,300 individuals, and they also produced over 70 resources. Working with Native populations is a primary focus of NITAC as well. It's one of our key areas of interest, so we're going to be continuing to partner with ANA and hopefully you all in producing more tailored resources in the future based on gaps and needs you all have identified. So we're very much eager for your feedback. And then I also wanted to mention the SORTA Health and Wellness training for any healthcare or public health providers on the line, or for anyone who engages with those sectors. The SORTA Health and Wellness is an accredited training on how to identify and respond to human trafficking. And this is a pilot initiative with our partner agency in OASH over at the Office on Women's Health. And we've created an online standalone module. There's 3 of them actually, for healthcare providers on their own time to go through and to complete these modules and then receive continuing education units. And we're really excited about that resource because we're starting to see states impose requirements for healthcare providers as part of their licensure renewal process that requires them to take anti-trafficking training. So SORTA Health and Wellness is just one solution to that. But NITAC continues to build out SOAR as a suite of materials for both individuals, organizations, and the community. And to request training from NITAC or to learn more about SOAR, I'd encourage you guys to go to our website. You can see that link here. Please also feel free to email info@nitac.org or call their call center at 844-648-8822, where you'll speak to a trained TNTA specialist who will assess your needs and help to provide a training plan.
Okay, so Candy, we are available now to answer any questions or hear comments, feedback from folks on how they felt the presentation went.
Great. We do have one question that came in. Elizabeth, when you were talking on this about the slide that had the AIAN trends, a question came in. Was that 143 reports of Native Americans for 2017?
That's a great question, Candy. So that is actually from December 2007 to December 2017. The hotline had received 143 cases.
Okay, so that's over a 10-year span. We have another question. May we add these handouts to our web page resource page?
Oh, yes, absolutely. We'd be thrilled if you did.
We have another question. Great presentation. Do you have any connections in Washington State? If someone wanted to meet or be part of a committee or group on the local level?
Yes, actually we do. I don't know if there's a way for us to connect offline. The WASH Act Task Force is very involved, and particularly King County on the western side of the state is sort of leading the way in terms of anti-trafficking efforts. But Michelle and I have spoken to our HHS regional counterparts out there in Washington who are really conscious of the lack of tribal coordination in particular. So NITAC is actually going out in early February to provide a human trafficking workshop to tribal audiences. There's a consortium of tribes who have come together. I think Tulalip is hosting that. And we'd love to send you that information so you're able to connect with that growing effort there.
Thank you, Elizabeth. We have another question. Are there more efforts being made so that better statistics are made available? And she has in parentheses, by law enforcement, healthcare, etc.
Yes, and this is a super important issue. As Beth explained, the Trafficking Victim Protection Act is sort of a new federal law, and it takes a while for different systems to catch up with the data. And because there are these overlaying other crimes that often go along with human trafficking, sometimes even though human trafficking might be involved, they might decide not to prosecute on it because they might not have enough evidence. So there's sort of some mismatch with, we don't currently catch all of the times it actually happens. We often have more data on just, the cases that were brought up, or, the successful prosecutions. The data we shared earlier is people calling into the hotline, in that particular hotline. So you have this whole arena of data that isn't yet captured and collated and brought to one place. ACF is working on a pilot to help human service providers capture the data in a systematic way where the different data systems can speak to each other and the specific data elements that you're collecting are similar. And there's a lack of funding to kind of roll that out, and there isn't a requirement to use it. So there's a lot of factors that are going into why we don't have great data. And as everyone on this call is probably aware, there's always sort of a lack of data on American Indian, Alaska Native. For the prosecution side, there's been some reluctance to identify victims as American Indian or Alaska Native, especially when they come from a small community and there's one case brought up that year. Then there's more opportunity for that person to be identified, and so their anonymity is not, they as a victim, they're not able to sort of protect their privacy. So that is, we have some low figures. And then also just if you have someone who doesn't present as American Indian, Alaska Native, or Pacific Islander to the service provider, then they might get misidentified as a different racial category.
This is certainly an issue that we are acutely aware of and are certainly advocating for at the ad hoc working group on American Indian and Alaska Native trafficking. So we are certainly raising this with our federal partners.
Thank you, ladies. I have another question. Do you provide technical assistance for tribal police departments seeking to start collaborative groups to address regional issues regarding human trafficking?
Sure. I would just note that we provide our training and technical assistance from a public health approach, which I think complements very nicely a criminal justice framework. There are criminal justice specific training and technical assistance resources, specifically the Office for Victims of Crime Training and Technical Assistance Center, or OVCTTAC. So I would encourage that individual to certainly contact NITAC, but also to consider OVCTTAC because they wear the criminal justice hat in our anti-trafficking space. But I will say we have trained law enforcement, and they've been very responsive to this public health framework as it complements their work and really understanding that as well.
Yeah, and I would also add additionally that the Bureau of Indian Affairs has some training available for tribal law enforcement, whether they're BIA or non-BIA. You can reach out either to me, Michelle, and I can get you in touch with our BIA counterparts on the ad hoc working group. One of the resources we're working on is sort of a crosswalk, is if you want training and technical assistance on investigations and prosecutions, then where do you go? And if you're a service provider and you're providing victim services and you want training and technical assistance, what are your options? You know, who are the federal agencies you would reach out to, and who are our grantees that, like NITAC, that are providing the training and technical assistance on behalf of the federal government. So look out for a resource from the federal government as we work to coordinate our services. We know that it's kind of it's a maze, right? And we want there to be no wrong door. So that's one of the purposes of this ad hoc working group.
Great. We have another question with regard to, is there any group you know of in Alaska to make Washington?
Yes, so the Alaska Native Justice Center is a OTIP grantee of ours. They have an award for the Domestic Victims of Human Trafficking Grant Program. I believe they're based in Anchorage. So if you go to our website, there is a grantee map there and contact information, but it's the Alaska Native Justice Center.
Okay, and I think we have one last question. Is identification based on victim self-reporting or based on federal definition, or on or is it racial ethnicity based?
Is that specific to the hotline statistics?
That was just how the question was worded. Is identification based on victim self-reporting?
Yeah, so I think it's both. So it is, we are working from a legal definition to ensure that, you know, the action, means, and purpose are present where appropriate, but relying on that victim or that survivor or that individual to self-identify. But there are individuals who are out there who are proactively screening those at-risk populations as well, individuals who might not know they've been trafficked, for example, you know, might think they're in an abusive relationship with their partner who in fact is trafficking them. So our grantees are doing both. So, you know, they do have individuals who self-identify, but they are also out there actively screening in, you know, areas where at-risk populations are more often to coincide and identifying them that way.
And in terms of identifying as American Indian, Alaska Native, that also would be dependent upon who the caller was to the trafficking hotline. But in terms of other agencies like Indian Health Service, they most likely would be reporting on individuals that would meet the federal definition because they would be eligible for IHS services. So it's that information is a little bit messy because it's going to be a mix of things that would, you know, meet federal definitions and things that would be self-report.
Yeah, and from what I understand from the National Hotline's perspective, it's a caller who is actively self-identifying or is referencing the ethnicity of their caller, or they're referencing perhaps a reservation community, and the call specialist taking the call happens to know that a local tribe is there and then asks to confirm. And so that's how that information is generated.
Thank you. We have one more question. When would you expect more human trafficking grants to be announced?
That is a terrific question. So as I mentioned, our Domestic Victims of Human Trafficking Grant Program will likely be recompeted in next fiscal year in 2019. So I would certainly encourage you all to keep an eye on our website for those funding opportunity announcements if and when they're approved to go out. Our other domestic focused program is the Look Beneath the Surface Regional Grant Program. And we actually just awarded those last fiscal year, so we wouldn't put another funding opportunity announcement out, assuming it's approved, until probably 2020. But I would encourage you all to also look at the Office of Violence Against Women over at the Department of Justice, the Office for Victims of Crime, OVC, over at the Department of Justice, certainly OJJDP and the Bureau of Justice Assistance, BJA, over there. Here at ACF, we have the Children's Bureau, the Family and Youth Services Bureau, and SAMHSA actually are all providing grants that work at the intersection of human trafficking and their core population. So some are looking at a criminal justice framework, some are looking at a violence against women framework, some are looking at a behavioral health substance use framework, but there are a lot of opportunities to apply for federal funding across those organizations in particular.
And for ANA, we have annual funding opportunity announcements, and we expect our grant for SEDS to open sort of in the next week or two. It will be open for 60 days. It is a highly competitive process, and you do have to be an eligible entity, meaning you have to be a federally or state recognized tribe or a native controlled nonprofit, our tribal college, Pacific Islander serving organizations are all eligible. You can check back on grants.gov or the ANA website to state funding announcements as soon as they are available. And I would either sign up for alerts on grants.gov or check back next week for our funding announcement.
And ladies, that looks like the end of our questions. We'll go ahead and if you could advance to the last slide with your contact information, that would be great, because I'm sure some of the folks on this webinar would like to contact you.
Please, and thank you all very much for taking time out of your busy schedules to be with us this afternoon. As Michelle mentioned, we have a lot of resources on our ANA and OTIP resources in our library, so we encourage you guys to visit us online as well.
Thank you, ladies, for presenting, and thank you, audience, for joining us today. Thank you.